Okay, so my presentation was on hospitals. So the history and origin of hospitals began in 4000 BCE. It was mainly religious groups that created healing facilities, and then that is kind of the basis of hospitals today. And then in 100 BCE, the Romans created military hospitals. They were primarily used for injured soldiers at that time. And then in 1099, the Holy Land Hospital was built, which was an example of a military hospital, and it could care for about 2,000 patients. Then in the 12th century, there was a rapid growth of hospitals in Europe. Then in 1524, we saw the first hospital built in North America, Mexico City, by a Spanish conquistador. And then in the 1540s, it was the dissolution of monasteries, which, in other words, since the majority of hospital ownership at that time was because of religious deities, the dissolution caused a stall in hospital building for about 200 years. So what's important to know about that is nothing happened in building hospitals until about the 1750s. So that in 1751, we saw the first incorporated hospital built in the United States in Philadelphia called the Pennsylvania Hospital. Then moving on to origin, I narrowed it down to about three. Anatolia, Turkey, Rome, and then religion is kind of the basis of all of the hospitals that were built. Then this is my information breakdown for these slides. I'm going to start with organization and talk about departments and wards in hospital, and then innovations that you could see in a hospital and some examples of those, and then different types of hospitals, and then I'll explain those and give some hospitals near you. So the organization of hospitals, this is just some of what you would see in a common hospital. There's medical nursing, which is just a broad term for many different types of nurses. So you could have surgical nursing, critical care, anesthetic, NICU, oncology, neuroscience, labor and delivery, things like that. Then emergency is where you would go if you came in an ambulance or needed emergency assistance. Administration, excuse me, that's the consent forms being admitted into the hospital, but it's also like the backbone of the hospital, and it's not many well-known jobs there, but it's important for making the hospital run smoothly. And then cardiology is a common department that a hospital would have just for heart and circulatory patients or problems. And then diagnostic imaging with CTs, MRIs, ultrasounds. Surgery will be very common in hospitals. That can be many different things like pediatric, general, neuro, cardio, many different things. And then gynecology and neonatal kind of go together. The gynecology will be for pregnant mothers and prenatal diagnostics, and then the neonatal is the support for newborns and families after the baby has been born. And then oncology will be for the tumors and cancer patients. And then pharmacy would be the purchasing, supplying, and distributing of drugs and medicine through the hospital. Social work is also kind of a not well-known department in the hospital, but it deals with the broad range of physiological needs for patients and families. And then some of the allied health components that you could see in the organization of hospitals would be physical therapy, occupational therapy, dental, speech pathologists, dietitians, things like that. And then throughout this presentation, I have just a few interactive questions. Then some innovations that I found. It can be anywhere from IV bags to like virtual reality. So just some that I found in the middle were like simulated hospital excursions. Some hospitals across the country use it for sick kids to go on a dream adventure. It's pretty much just a very large virtual reality. And then laser glucose monitors would be used for diabetic patients, and they're considered non-invasive and accurate. And then smart medicine cabinets, they're basically just, they can be used for anything really, like drug dispensers, and then sometimes they have them for tools and like IV supplies and things like that. And then pulse oximeters, antibiotics, they have new antibiotics coming in all the time. And then drug distribution machines. And then this is another interactive question. Then I'll go into the types of hospitals. So there's primarily 5 that I'll be talking about. The first one is public. That one is important to know that they're government funded and they solely rely on taxpayers. So they don't pay for any of their own things. It's the government that pays for that. And with that, there's usually less services offered, but it is less expensive. And an example of a public hospital near you would be St. Francis Regional Medical Center in Shakopee. And then a private hospital is owned by a group of people or an individual person. It's just what's important to know about private is they usually are very wealthy people who create these private hospitals. So they have a freelance budget, meaning they just make up where they want to put their money, and that usually results in more treatment options, but they don't have any government funding. An example of that would be Abbott Northwestern in Minneapolis. And then a nonprofit hospital is what the IRS views as charities. So nonprofits don't pay taxes, state or federal, and then a lot of times nonprofits are affiliated with religion. And these are a lot less well known in our area, but one in Minneapolis is the ANW Hospital FDN. And then another type would be a teaching hospital. These are affiliated with medical school if you were to go here, you would see people finishing up residency or their final years of medical school being taught by professionals and learning patient care. And an example would be Mayo Clinic in Rochester. And then a Veteran Assistant Hospital is a hospital operated by government expenses, and then it cares for retired veterans and military personnel. And an example of that would be the Minneapolis VA healthcare system in Minneapolis. So I created a short quiz, 6 questions, and then the answers are right there. Thank you so much for listening. And these are my references.